One of the themes of the Head and Neck Cancer Foundation's research direction is the early diagnosis of cancer. So we'd like to introduce another of the Guy's technologies. This is called the microvasculoscope or microendoscope, looking at the pattern of blood vessels in somebody's mouth. It's a hard fact that all oral cancers develop from the lining surface of the mouth, the skin of the mouth, and start to invade through the glue line that joins the skin to your insides, called the basement membrane. By definition, once that membrane has broken and the dividing cancer cells have started to invade the body, the lesion has become malignant and is then invasive. The race is on to find it and to remove it at the earliest opportunity. Tumours all need blood vessels to feed them so that they can grow, and that new vessel development shows us exactly where the tumour margins are. And when you look inside somebody, there is very little contrast between tissues and tissue types. So it's very hard to see one thing from another without using dyes and stains. But of course, hemoglobin, the red pigment within red blood cells, is a natural contrast agent. So we've developed an instrument to look for individual red blood cells moving within small circulations. The idea being that that movement reports the shape of the circulation and therefore the presence or not of the tumour that we're interested in. One particular tale is of a patient within the Head and Neck Cancer Institute here not so very long ago, for whom there was a small mark on the cheek of tiny proportion and not really diagnosable as anything. That lesion was examined with the wand and the characteristic vascular pattern was seen, suggesting tumour. A biopsy of the lesion ended up excising the entire tumour in one go. It was less than 1 millimetre in diameter. So the definitive biopsy became the cancer operation all in one go. Case closed.